Hello, Dr. Christopher Gay again, Foundation Health Partners, Pain Management. Another topic in our series on pain issues and pain treatments. Today we want to talk about radiofrequency ablation, primarily of the facet joints. Facet joints are located in your lumbar spine, thoracic spine, cervical spine, all throughout your back. And they're essentially where each of your vertebrae meet with the next neighbor. You have one joint on each side, and then each level, there's two joints. And these joints can develop arthritis just like other joints in your body, and that pain can become quite debilitating. People often experience pain when they're standing, especially prolonged periods of time. They'll say, I'm fine walking through Costco, but when I get to that checkout counter and I'm standing in that line not moving, that's when it really hurts. That type of pain can be treated with radiofrequency ablation, which, if successful, can reduce your pain significantly for about 6+ months, 6 to 9 on average, sometimes as long as a year. How do we know if you're a good candidate for that? Number one, your imaging shows that you have arthritis in the back. Number two, which probably should be number one, is that your symptoms match up to this type of pain. And on physical exam, we can reproduce it with typical tests that cause pain with the facet joints. And number three, we can do test injections to see if your pain actually responds to a little bit of local anesthetic that's placed on the sensory nerve that transmits this pain out of the joint. We inject little local anesthetic at each of those levels, and your pain should reduce by about 80% or more. If that's the case, we have to repeat that to confirm it, usually a couple weeks later. But if you have successful relief from both of those, we can progress to radiofrequency ablation of the facet joint. Over 200,000 of these procedures are done each year in the United States. And of course, each insurance company has their own guidelines in terms of whether you can have it done on both sides or have it done more than twice, but typically it's not covered more than once every 6 months. So what is radiofrequency? We're using heat energy that comes from this radiofrequency device to heat up these specific sensory nerves. If you think of the sensory nerve as a wire, an electrical wire with a coating on it, this heat essentially is going to melt that coating so that signal does not get through. So essentially we use radiofrequency, the heat energy, to target these sensory nerves to interrupt that signal that reminds you that you have arthritis constantly. That usually, again, lasts for about 6 to 9 months, maybe even longer. And when you come back, we don't need to repeat those test injections again, as long as you've been treated within the last 2 years. We can jump right back in at that radio frequency at those same levels and get you back to enjoying your life. If you feel like this may be a treatment for you, give us a call and we'll be happy to evaluate you. Thank you.